Welcome to the American Academy of Grief Counseling's Videogram on Postpartum Depression. And this is a type of depression that occurs after the birth of one's child or baby. And that's why it's called postpartum, after birth itself. So postpartum occurs after the birth of a child. It primarily strikes women, but it can also occur in men, believe it or not. It simply steals the joy of a child that you have just had. And if untreated, it can definitely lead to child neglect. It can lead to substance abuse and other things that endanger not only the parent, but also the child. With it, one feels worthless, unhappy, isolated, and unmotivated to perform care tasks. And this is just your basic depression symptom list. So if it lasts longer than 2 weeks after a child or baby is born, one should seek professional help and see if they are experiencing postpartum depression. Coping with postpartum depression usually involves a type of medication, especially since the primary issue is brain chemistry. Sometimes the serotonin needs to be rebalanced in itself. But there are also other ways in which one can act in life and cope in life to help oneself throughout this process, which is supposed to be a very happy time. So self-care and support. Self-care is key. Proper diet, sleep, and exercise. Finding time to reset. And this might be easier said than done because babies demand time. But it is so important to remember that self-care is still critical in itself. One needs to reset, recharge itself. So support and self-care. Self-care of oneself, but also support from one's partner and family are extremely important. Unfortunately, many single parents lack family or support, and they must rely on state support systems, which are far more difficult to navigate. So this can be a bigger problem in single parent homes, especially. But if one is still blessed to have their partner, it's important to understand with postpartum to communicate one's feelings, to reach out when possible, and to seek counseling or support groups, especially if you're on your own, to seek counseling or support groups to have a better understanding of what one is going through in itself. For childcare, it's important to set realistic goals in care of your child, establish routines, and identify things that might trigger the depressive feelings that one is experiencing. So as a parent, this is supposed to be a happy time, but sometimes depressions occur. And when these types of postpartum depressions occur after the birth of a child, it's very important for the child's well-being as well as your own to find the self-care needed, to find the support needed, and to also understand what you need to do to make sure that your child is properly cared for. We are the American Academy of Grief Counseling, and this was just a simple short video on postpartum depression. If you're feeling any of these symptoms, please seek your healthcare provider or your mental health care provider and receive the help that you need for your own self and that of your child. For those of you looking to become certified in grief counseling, there's our link below. Our email is info@aihcp.org, and our phone number is 330-652-7776. I'd like to thank you for listening and have a good day.